All right. Yes, our time has come. Dr. Darwin Ang is in the studio. He's been with us before. He is the guest of supermodel Lauren Debick. Look how beautiful you are. You don't even know.
Wow.
You don't even know how beautiful you are. Dr. Ang has been with us before. We're talking today, it says here, about the graduate medical education program at Ocala Health. And so good morning, Lauren. Good morning, Doctor. I hope I said that right. Did I get anything wrong there? Or right? Yeah, how come I don't hear anybody? Yeah, there you go. How are you?
Excellent. Thanks for having me again, Larry and Robin.
Before we went on the air, we learned about bananas.
We did.
Apples.
We did.
And concussions.
ABC.
So is this an educational program for all of us, or just for people studying to be doctors?
The graduate medical education,
Yeah.
it's a program to train doctors become professionals in their respective fields. So basically, these are people that have graduated medical school, and now they're seeking additional training to either become internal medicine physicians, surgeons, family practice doctors, internal medicine.
Do you know what the big difference between what you do and what we do? In order for you to be a professional, you have to go to school forever.
Yes.
All we have to do is get paid. They say, are you a professional broadcaster? Well, I don't know. Do you get paid? Yep, you're a professional.
There you go.
So what do you mean you teach them to become professionals?
So literally their designation is resident. And what a resident really is, literally it means someone that lives in the hospital. In the old days, that's what the trainees did. After they finished medical school, they
literally
would
lived in the hospital?
Yeah, they would live in the hospital, and through an apprentice model, follow a physician around for several years until they were determined competent enough to practice on their own.
That would be comforting to anybody who needs that doctor, knowing that they were a resident or a what do you call, shadow or something, apprentice?
Yeah, and now we call it residence, just a general term for anybody doing this postgraduate training. And there's different fields. So, for example, I'm the program director for general surgery, and these medical students have to apply for these residency programs all across the country. And of course, they come from all across the country. They have to do well in school. They have to do well on their exams. They have to take a licensing exam to become basically what we call a general practitioner. And then after that, they get selected to the different residency programs through an interview process.
Did you go through that yourself?
I did. Many years ago,
Well,
I did.
do you remember? What is it like when you first do it? Is it scary following a doctor, especially a surgeon?
Oh, the residency program? It's very intimidating, especially in surgery, because it's one of those fields where you literally don't know anything when you come out of medical school.
As much as you've learned,
Right.
It's almost like you're starting over. So do you have hands-on, or are you basically just observing?
So we like to call it graduated responsibility. So in essence, there's 5 years, for example, in general surgery. The first year, the interns, mainly they learn about systems, about the preoperative care, how to take care of patients before surgery, how to take care of patients after surgery. They learn about efficiency. They learn about a lot of hard work, and basically getting through the grind. And as the years go on, they're gradually handed the scalpel and that huge responsibility.
Gradually handed the scalpel?
Yeah. Well, it's a huge responsibility, right?
I bet, yeah.
Somebody who's brand new cutting on you, right?
No, I know. I'm just
some experience.
gradually handed a cleaver if you're a butcher, I guess.
Exactly. Well, so it's the responsibility of the attendings, and these attendings means these are the people that are training the residents, and so they're usually experienced surgeons. Some would say master surgeons, depending on the number of years that they've been in practice. sort of determine when they're ready to be able to do surgery.
Does it never end? What I mean is, like, let's say, for example, you are very experienced, but now there's a new procedure.
Correct.
Somebody else is doing that procedure. Do you now have to be a resident of that doctor just so you can learn the new procedure?
That's a great question. You don't have to go through the amount of time to do that, but you can. There's clinics that are held by those experts that you can go visit them. So, for example, if there's a new technique on fixing a hernia, that expert might hold a clinic for a couple of weeks so that you can learn that technique. If it's something way more involved, then there's a vetting process that even the hospital has to get into. You have to do X amount of procedures before you can start doing them on your own. You have to be proctored by somebody that flies in and things like that.
We have a lady on Tuesdays that does the gardening show, Carol Ann, and she had her gallbladder removed, and it was outpatient, and she showed Larry her scars, and years ago, if you would have had that done, your whole body would have been opened.
Right.
But now they're very small.
Yeah, no, medicine changes really, really rapidly, and that's the great part of being part of a graduate medical education. You're always part of the forefront in terms of technology and medicine. And so, one of the unique things about starting a program in Ocala is that we get to adapt to the current clinical paradigm of how the hospital systems has changed throughout time. So in legacy programs, programs have been established for hundreds of years, 150, 70 years and stuff like that. They're still under this paradigm where everything can be done under one roof. Well, you and I know that there's lots of centers of excellence now. And the way healthcare has changed is that you have these places where you have experts build these centers of excellence, and that's where all the patients are going. Well, medical education for the graduate hasn't adapted to that yet. And so one of the great things about the Ocala program is that we've kind of adapted to that paradigm, and kind of now our residents have the opportunity to kind of live in an environment that they'll be ready for when they graduate.
I think I know what you're saying, but I want to ask it again just to be sure, because what it sounds like is something I'm really happy to hear. We will speak to doctors all the time from is it the Children's Hospital of Philadelphia?
Yes.
You know what their initials are? CHOP.
Right.
CHOP.
Yeah.
Of all the, you don't want to go to a hospital called CHOP, but apparently this is like a really great hospital for children, right?
It is.
I've often thought, why can't we do that here? Why do we have to it's not that it's that far, but it'd be nice if the children could go to a hospital right here rather than all the way up to Philadelphia.
Well, that takes a lot of resources. There are experts in those fields that, to aggregate all those experts together and things like that takes a monumental amount of coordination, facilities and things. Now, our general surgery program, they're required to do pediatric surgery, and they do all the rotations at Johns Hopkins All Children's down at St. Petersburg, which we have a partnership with them. And that's really that model, basically, of following where are all the patients going. So they're going to these freestanding pediatric hospitals and learning from those experts there. In fact, one of the reasons why I have our residents going there is one of the people that trained me in pediatric surgery is actually one of the professors down there. And so, you kind of know what you're getting into with each of these rotations.
And now you have two programs that started this month, emergency medicine and general surgery.
Right. So we were talking mainly about the general surgery earlier, but it's also very exciting that we also have an emergency medicine residency program, and that's different from surgery, where their focus is mainly in the emergency department and dealing with acute and critical illness as the patients hit the door. And so they learn about resuscitation, triage, a lot of common medical conditions. They're basically learning what it's like to be the forefront of that physician provider for these patients that come to the hospital.
And you also have to have the social skills, not just for the doctors, with the nurses, with the team themselves, but also with the patient and their family.
Yeah, Robin, I think you hit on something that a lot of people sort of overlook, but that's absolutely true. So in a residency program, you're not just learning the physiology and the medical aspects of being a doctor, but you're also learning how to be a team member, you're learning how to be a leader, you're learning about resource utilization, and all those things that we're training physicians, modern day physicians, to be, is the complete physician. And to be able to lead, to be able to triage these sick patients, and kind of basically move care forward in an efficient, a cost-effective, efficient, and most beneficial way for that patient in front of you.
When you are dealing with somebody where surgery will help, I don't even know how you do that. But what's even harder for me to understand is when somebody has like a viral infection or something. In other words, there's nothing you can cut. It's or take out. It's how do you? How do you know, and how do you shadow somebody in that circumstance? Because you're not watching. Okay, you cut this, you sew this up. It's I don't even know how you know it. Is it a matter of measuring?
So, in surgery, we have a saying that a good surgeon knows how to operate, a better surgeon knows when to operate, and the best surgeon knows when not to operate. And so that's really part of the, whole paradigm of surgical training, is determining when is surgery going to help somebody get better and when is surgery not. And, you spend 5 years learning that, but you spend a whole lifetime figuring out who's going to be the best for. And so that's a great question, because sometimes we don't know, but a lot of times for us the default is, if someone's dying right in front of you and they want everything done, then maybe surgery is the only option for them.
Now, when the residents get out of medical school and then they begin their residency, do they have the title of doctor, or does that come later?
As soon as you graduate medical school, you are definitely a doctor. You're a medical doctor.
Is that hard to get used to?
For them, as soon as you get out of medical school, and I think everybody's guilty of this, everybody wants to wear the stethoscope around the neck, and they want to be called Dr. So-and-so. That kind of goes away after the first month when they realize they don't know anything, and they go back to their first name.
Oh, really?
Yeah, it's, the medical residency experience is very humbling, because you learn so much in medical school and you know so much, but at the same time when you start residency, you don't know anything at all. And it's really, it's one of those things that are very cyclical. At the end of your 4th year as a medical student, you have studied so hard for your licensing exams that you think you know everything under the sun to pass that exam. And then your first day of residency, as whether you're in emergency medicine, internal medicine, or as a surgery resident, you don't know anything at all. And so you start from the very bottom again. And it takes another 5 years to get there.
Gosh, wow. So what is the etiquette? This is a stupid question, Lauren. I'm sorry. It's in my contract. I have to ask at least one. What is the etiquette when somebody sees you for the first time? You're Dr. Ang.
Right.
How many times do I have to see before I can start calling you Dr. Darwin? I've noticed that people do this. They will attach the title doctor to the first name. Like this would be Dr. McBlain. For a few whiles, whatever, for an hour or two, and then it's Dr. Robin, right? When is that? Do you get that? Do you get people who call you Dr. Darwin?
I do, and I think when you're in a hospital setting and you want to establish that patient-physician relationship, then the etiquette is always addressing the physician as doctor, because you don't want. Not that you don't want to be friendly with the patient and things, but you want to make sure that whatever you're telling the patient is under the guise of that professional treatment that you're rendering. But when you're, out here in the mall and things like that, then calling everybody by their first name is completely appropriate.
But still using the word doctor.
You don't have to. No, I don't think so. Now you can introduce this is my Dr. Darwin, and he took care of me, whatever. I don't think anybody really cares about that, because once you're outside of that professional environment, you're a human being again.
It's just weird when the first name is Bill, isn't it?
No,
Dr. Bill. It just sounds like something you get in the mail with a little window on it.
Normal names, first names too.
You yourself, Dr. Ang, you are really exemplary in your field and with the patients and everybody that you meet. And Ocala Health is outstanding. We just got a press release from Lauren about another accolade and awards that were given to Ocala Health in general. And so you probably are considering the programs that you're doing and spearheading pilot programs for other hospitals.
Yeah, that's absolutely right. I think for surgery, we're the fourth surgical program in the last 2 years for HCA, and the first surgery program for the University of Central Florida. So our program is unique in that our program is actually the surgery program for the University of Central Florida in Orlando. And UCF partnered up with Hospital Corporation of America to create graduate medical education program. At the moment, they don't have a hospital campus, and so what they've done is partnered up with HCA that has a lot of hospitals, and in those hospitals have chosen to put in different kinds of graduate medical education programs: internal medicine, OB-GYN, EM residency. So Ocala is very fortunate to be the only one right now doing general surgery.
So if somebody was listening and they wanted to know more about the residency program, I'm guessing if they've already gotten to this point, they probably know about it already, right?
Right. So if you're a medical student, there's something that goes through a national organization as far as the national matching process, the NRMP, basically. And we are listed in that matching process, and they basically just go down the line and figure out which programs they want. They'll choose it. We have a website that they can read about, or sometimes they'll do research on the faculty at the hospital, and they'll see what kind of things they published, what's their background, what highlights it. But I think the other big sell is when they come in and they interview with the other residents to see what their education is like, what kind of cases they're exposed to. For the EM residents, they want to know what the volume is like. What's the case mix of patients in Ocala and stuff?
Okay. Does the resident ask questions? Probably not during, right? I mean, you don't want to ask questions.
So so when you're a medical student, you put in an application. There's an essay part. You have to send in your board scores. You have to send in your transcripts to the medical school, and then you write an essay about why you want to go in that specific field. And then as a program director, we can screen based on scores or where they came from and things like that. And then from that, look at all the material and then select who we want to interview. And then they, out of their own pocket, they fly all over the country and they interview with you and then your faculty. And then at the end of the day, you basically
really?
have a list of applicants that you like, and then you submit that to the NRMP. And then there's sort of like a system that sort of matches, like they have their top ranking choices of all the programs that they have gone to. And the program has its top applicants that they ranked. And then somehow you sort of cross-match their list and your list. And at the end of the day, you end up with, the people that you end up with in your program.
And what that means for us as patients is that you basically are able to pick the cream of the crop, it sounds like.
Oh,
right?
we did. I mean, if you look at our residents, and I can speak for general surgery, we have some of the best residents in the country from coast to coast. We have residents from New York. We have residents from the Midwest, Missouri, Colorado, University of Washington, UC San Diego, University of Texas. And these are people all over the country that want to come to Ocala to learn how to be surgeons.
Isn't that amazing? That's something to be proud of, isn't it? Wow.
When the residents are accepted in their chosen field for a hospital such as yours and yourself, do most of them stay with that field, or is there a time when they say, I think I might want to go into a different field, or do you observe that maybe they might be better suited for a different field than what they think they want to be?
So the short answer to that is yes. I mean, but it's a very, very small percentage of people. Usually once you make a commitment to a residency program, you become that doctor about 90% of the time. Mm-hmm. And then 10% of the time, they either change their minds or they don't have the aptitude to continue. And then if that happens, then it's the program director's responsibility to figure out what kind of course that they should take. First of all, do they want to continue with medicine, and if they do, and if surgery, for example, is not their cup of tea, or they're not excelling in that after a couple of years, and there's a stringent process, by the way, that helps you determine that. There's committees that you have to go through and things like that. Then you kind of help them find that field that they're interested in. And so it's not that common, but it does definitely happen.
You're the perfect person.
You are clearly speaking to
Absolutely.
two separate groups of people. You're speaking to the patients, and they are being comforted knowing that the doctors under their care have gone through this big, long process to make sure that they know what they're doing. But I'm guessing that that's the current listening audience on the radio. I think the people who are going to share the video are probably medical students, and they're probably just as interested in hearing what you're saying also about the program here.
We can help prospective medical students come into Florida and be great surgeons to serve our community. That'd be great.
So talk to them just for a second. We have like 5 or 4 minutes left. Talk to them, because I'm guessing that this video, Lauren, will be shared by them, saying, you know what, have you checked out this one in Ocala, right? Yeah. What should they know?
Well,
this might be over my head, so that's okay.
No, not
everything is pretty much.
Well, first of all, Ocala is a great place to live.
Oh, I got that. I can handle that one.
One of the best things about the program in Ocala, that it is a program that is part of the University of Central Florida, so it is an academic program. The other great parts of it is that this general surgery program that we have is an operating type of residency program. So the residents will do a lot of surgeries. It also follows the paradigm of modern day hospital systems and clinical care. And so we built this residency based on where the patients are going and who the experts are in those fields. And so the attendings are master surgeons that have years and years of experience and success in their fields. And so not everything is going to be in Ocala, but it is centralized in Ocala as far as the administration goes. But they'll be working with experts in their fields all over Florida. And they're going to have a great training experience. And by the time they graduate, they're going to be very, very good surgeons.
See, we're the horse capital of the world. Maybe we're the doctor capital of the world, too. Right?
Yeah,
people come here from all over the world, it sounds like.
Well, the great thing about having a residency program that's strong, whether it's in internal medicine, emergency medicine, surgery, is that these physicians, the best ones that we graduate, will be the ones that we want to retain in the community to continue serving everybody here.
Right. Yeah, that's good for the rest of us.
That is very good for the rest, because what in addition, not just to the manpower, it's also, there's a responsibility to teach these residents the latest in medical technology, medical science, and physiology. So not only are we making the medical community better because they have to learn more and stay up to date with the medical stuff, but the treatment that we're rendering our community right now is also benefiting from all of this advances in knowledge and technology and things like that.
We're almost out of time. Let me ask Lauren, talk to the people who are listening now, and also to these people watching this video right here. I'll put my finger in the picture. Because I really think this particular interview it's got two groups of people, right?
Absolutely. So there's 2 different ways to learn more. You can go onto our website. It is ocalahealthsystem.com to read about each of the individual programs, or you can call our number at 1-800-530-1188 to get more information about it there as well.
And do they have this information at the schools that they're going to? I mean, do they already know, okay, here's where you could have your residency program? Is that already part of the curriculum, I guess? I don't even know how to ask that.
Yeah, every program has a website landing page that they can learn more about the program.
Oh. Do we have an address?
OcalaHealthSystem.com.
Oh, just the same one? Okay.
Yes, and then if you want to get specific, it's the tab Medical Professionals and then GME, and then each of the programs are listed.
Oh, okay. I see a few people commenting right now. They're going to go to it. Okay. Thank you for coming in, and thank you for the update on the last time you were here. I'm glad to hear it made a difference.
Now, this has been a great show, and it's been a huge advocate for the existence of the trauma program and to serve the community. Over 10,000 patients later, we've really made a huge impact, and really appreciate Larry, Robin for helping us.
And
spread the
Lauren,
word.
we wouldn't even know about you if it wasn't for Lauren. Thank you, Lauren.
Thank you for having us.
Thank you.